Well, speaking of health and fitness, this weekend is the WTHR Health and Fitness Expo, and we're very excited about it.
Anne-Marie Tunin is here with a topic that will be discussed at the Expo, and that is our aging parents.
Yeah, one of many topics that we'll be discussing. And when our parents age, it is heartbreaking, especially when we see that the parent doesn't recognize us. Alzheimer's and dementia slowly take our memories and sometimes alter personalities. I recently met with an Avon woman who says coping is better when you realize despite the disease, your loved one is still a gem.
I can't remember sometimes, you know.
It's frustrating for Martha Weddle. She doesn't remember if her doctor told her she had dementia.
Probably if he did, it was when I didn't know what dementia was, you know.
Do you know what dementia is now?
Yes.
What is it?
Where you forget and you can't keep it all in here. Is that it?
That's it. And with Martha and her disease stage, we may have this conversation time and again, day after day.
Try not to ask why.
Melinda, her only daughter, is single and says she misses the intimacy and connection with her mom.
It's just hard. I kind of isolate myself that way, but that's probably the hardest part, is just not having anybody to ventilate with, I guess.
How are you today? There is help from the staff at Brownsburg Meadows. They're trained in the Teepa Snow GYMS model to help better care for and understand the residents. And as part of it, each resident is classified as a gym.
She's who we would consider to be a stage 4 and now what we call an emerald. And when we call her an emerald, essentially what we're doing is we're trying to give our staff a visual cue as to how to take care of her.
So emeralds are in Martha's memory box outside her room. They're on the bulletin board and elsewhere. A constant reminder that these emerald green patients are on the go.
Kind of her thoughts are kind of on the go. One of the things that's difficult with communication of an emerald is that she can answer your question initially, but then the ability to stay on the topic or to continue that thought process is very difficult for her.
To help, staff and family are encouraged to follow the See, Talk, Touch approach. Make sure the senior sees you. Then introduce yourself on each encounter, and after that, touch.
She's actually become more relaxed since she's got here, too. We had some behavioral issues before we came out here, and those really have basically gone away.
Those who care for these seniors urge caregivers to understand that this disease is a progression.
This is my mother, and this is my dad.
It's not going away, it's only going to get worse.
Focusing on what your loved one can do instead of what they can't.
I love she's still so mobile.
Makes the evolution easier to endure. Well, if you'd like to learn more about this gym staging and perhaps which gemstone best matches your loved one, you can do that through a link at our website, WTHR.com. Also, if you'd like to meet with a memory care specialist from American Senior Communities, you can do that this weekend at our Health and Fitness Expo. It's 10 to 5 Saturday and Sunday at the State Fairgrounds. Go to our website, WTHR.com, and there you can get a free ticket and learn more about the schedule. John?
Colts coach Chuck Pagano.